In most classrooms, the students who get attention are the ones who disrupt. They call out, they move, they struggle out loud. But what about the student who doesn't? The one who sits quietly but is completely lost? Same condition, different presentation, and one of them is far more likely to be missed. Attention deficit hyperactivity disorder, or ADHD, is often described as a condition that primarily affects boys. But current research tells a different story. While boys are diagnosed more frequently in childhood, that gap nearly disappears in adulthood, which suggests something important. Many girls were never identified in the first place. This matters because when ADHD goes unrecognized, it doesn't disappear. It compounds into academic struggles, emotional distress, and long-term consequences. Research shows that boys are diagnosed with ADHD at significantly higher rates during childhood. However, population studies suggest the actual difference in prevalence is much smaller. According to the CDC, more boys receive diagnoses, but large-scale studies indicate girls with similar symptoms are more likely to be overlooked. Why? Because the system is designed to respond to disruption. And ADHD in girls often doesn't disrupt the room, it disrupts the individual. So the question becomes, what are we missing when we only look for what's loud? ADHD does not present the same way across students. In boys, symptoms are often external: hyperactivity, impulsivity, visible disruption. In girls, symptoms are more likely to be internal: disorganization, forgetfulness, mental restlessness. Some may appear attentive, but are constantly losing track of information. Others talk excessively or feel internally overwhelmed. Research consistently shows that girls are more likely to present with inattentive symptoms rather than hyperactive ones. And because those symptoms are less visible, they are easier to ignore. Many girls learn early to mask their difficulties. They compensate, they work harder, they try to meet expectations quietly. But that effort comes at a cost. Instead of being identified, they are often labeled as inconsistent, unmotivated, or emotional. Research also shows that co-occurring conditions like anxiety and depression can mask ADHD symptoms, making accurate identification even more difficult. So what adults see is not always what is actually happening. When ADHD is missed, the consequences build over time. Studies show that females with ADHD experience higher levels of anxiety and depression, greater functional impairment, and later diagnosis compared to males. There are also increased risks: self-harm, relationship difficulties, chronic low self-esteem, not because of the condition itself, but because of years without understanding or support. What happens when someone spends years being told they're the problem, when the system never recognized the need? So what does this mean in practice? First, we need to expand how we identify ADHD. Not just disruption, but patterns of disorganization, inconsistency, and mental fatigue. Second, educators and parents should pay attention to students who appear to be trying but not progressing. That gap between effort and outcome is often a signal. Third, screening should be more intentional. Students presenting with anxiety, depression, or academic inconsistency should also be evaluated for underlying attention challenges. Fourth, training matters. Research shows many educators report difficulty identifying ADHD in girls. And finally, support needs to be integrated. Academic strategies alone are not enough. Students may also need support with self-esteem, organization, and emotional regulation. ADHD is not a male disorder. It is a condition that presents differently across individuals. And when those differences are ignored, students are left without support.
The issue is not just identification, it is understanding. Because the students who do not demand attention are often the ones who need it the most. This video was developed by Dr. Charles Edwards in collaboration with Music of the Free Inc. Please share it with anyone you believe could benefit from it.